chapter 50 on the dermatological disorders. I'm going to kind of go quickly on this. There's just some things for you to take note of. So the first chapter starts with all your acne treatments. There's multiple treatments for acne. So for the mild treatment, keratolytics are common. Your text goes over quite a few of them. They're drugs that facilitate removal of the outer layer of the skin. Salicylic acid and benzoyl peroxide are over-the-counter medicines. If you read the ingredients on a lot of those over-the-counter, all those over-the-counter acne medications, it's one or both of those combined. They come in creams, gels. Benzoyl peroxide used once or twice a day loosens up that thing's prescription. Tretinoin, or as most people know as retin A, is a vitamin A derivative for mild to moderate acne. And again, it is a prescription. Some other agents, well, the benzoyl salicylic, I'm looking down your list here. So I just threw some things up here because they do start, let's see here. Your topical vitamin A derivatives, the tretinoin was one of them. That here is your adapalene, and here you see the retin A, which again is your tretinoin. They're category B and C in pregnancy. Topical antibiotics, tetracycline is a very commonly used one. It can be used topically and systemically and topically. Sometimes they combine and do both of those. The systemic acne treatment, there's a lot of precautions here with pregnancy. So tetracycline, the tropical corticoids or steroids can be used. Pregnant patients should not take tetracycline because of tetragenic effects. Isotretinoin for cystic acne, orally or topically, because it decreases the sebum formation. It's used for 4 to 6 months. Adverse effects are irritation, pruritus, hirsutism, that's the extra hair growth on the face, photosensitivity. When they're taking these vitamin A or tetracycline along with the isotretinoin, you have to monitor their blood work. Initiating isotretinoin therapy, interval throughout therapy. Do not breastfeed. Do not give blood during or 1 month after therapy. Do not take any other medications or herbal products without first consulting a healthcare provider. Don't drive at night without knowing the effect of the isotretinoin on night vision. Avoid exercising vigorously. Stop taking the isotretinoin and call your provider if experiencing muscle weakness, which may indicate serious muscle damage. Monitor the CBC, glucose and lipids, and urinalysis. Absolutely no pregnancy during treatment. It is a category X. Because of its powerful tetragenicity, they have a council called the SMART Council, SMART system, to manage Accutane-related teratogenicity to ensure that no patient is pregnant when treatment is initiated and no patient becomes pregnant while taking the drugs for at least 1 month. There is this I Pledge program, and so it is obviously very significant issue. I want to point that out. So psoriasis can be treated topically with multiple things depending on the degree of it. As a chronic skin disorder, it can usually affects the scalp, elbows, palms, hands, knees, and soles of feet. although it is a topical skin disease, some people get it significantly where it can actually cause a psoriatic arthritis, so it can become a systemic disorder. Can be very debilitating. Usually initially treated with topical glucocorticoids, which are your steroids, topical preparations such as anthralin, sulfur drugs, coal tar. For the mild to moderate, the calcipotriene, which is a synthetic vitamin D to suppress that cell proliferation, because that's where they have this buildup. Tazarotene is a topical treatment for moderate psoriasis. Ultraviolet light treatments, methotrexate, which alters the immune system, can be used for it. Sometimes a combination of these treatments are used. When it's refractory, not responding, they go to the biologic agents, and your text goes into a lot of those. I am not going to ask you to have to know those, just that they can be used. Chills are a common side effect of this, of a few of them. Treatment goes on for several months. And I think that's all I'm going to expect from you on that section. I'm going to keep moving. Verruca vulgaris, fancy name for the common wart, hard horny nodule. Oh my goodness, I'm sorry. It's like salicylic acid, which is actually aspirin. If you get the over-the-counter treatment for warts, that's actually what it is. It can be very, very effective. Sometimes combining it with doing the salicylic acid for several days and then coming in and doing the freezing, it tends to work better to do that combination treatment. Podophyllum resin is for venereal warts, and it's not effective on the common warts. This drug should not be used on large areas because the podophyllum, because it's tetragenic and never used during pregnancy. You have a nursing process section that covers the acne vulgaris and psoriasis. Make sure you look over that. I'm just going to keep going here. Drug-induced dermatitis, rash, urticaria, papules, vesicles, life-threatening erythema multiformes. Make sure you look over these. I did put your description here. Stevens-Johnson syndrome, the large blisters in the oral and anogenital mucosa, pharynx, eyes, and viscera. Your erythema multiformes are red blisters over a large portion of the body. Toxic epidermal necrolysis, which is the widespread detachment of the epidermis from underlying skin levels, and we saw that once with a dilatant reaction, which was, it's horrendous, horrible. These are some common, penicillin is commonly a cause of it. So just be familiar with those drug-induced dermatitis, what each name actually means, what it looks like. Contact dermatitis is obviously just coming in contact with something that you respond to. It can be cosmetics, perfumes. Had people with they change their shampoo, they have a rash down their back. Multiple things can do it. Sometimes it's several exposures before the body actually has a very profound response. Poison ivy is a contact dermatitis. Not everybody is allergic to poison ivy. Not everybody will react to it. Sometimes you don't react for 20, 30, 40 years, and suddenly you do react. So different kind of managements for them. Calamine lotion, sometimes Caladryl, which is a combination of calamine and Benadryl. If somebody uses that, they are not to take the oral antihistamine at the same time. Bore solution is put on with wet dressings. It's made of aluminum acetate. I mentioned the calamine zinc oxide. Oh, I don't have that on my screen. Zinc oxide, a lot of the diaper rash things have zinc oxide. Zinc oxide is excellent for protecting and helping for dermatitis. Topical antipruritics, those are ones to help you not itch. Should not be applied to any open wounds. I think that's a given. Dexamethasone, again, there you go with your corticosteroids, hydrocortisone, remember the zone, methylprednisone, sometimes taken orally, sometimes topical, depending on the degree. A portion of topical is absorbed systemically. Impetigo is a staph infection, most common in the ages of 2 to 5, treated with mupirocin, which most people probably know as Bactroban, and it is prescription. That's the one you will see used most often. It can be anywhere on the body. A lot of kids will have it actually around their nose from picking their nose and their hands being in dirt. And it can be up into the nose too and have to be treated with the Bactroban up the nose. Hair loss and baldness, which is called alopecia. Some drugs cause, antineoplastics are a very common one. Some of the sulfa drugs will do it. Anticonvulsants like your Dilantin have that as aminoglycosides that have so many side effects. Sometimes long-term non-steroidals can also cause it. Indomethacin, which is one of the non-steroidals, it's one of the major non-steroidals for causing alopecia or hair loss. Some people have it with their hypothyroid, sometimes with pregnancy, they can have that too. So minoxidil, which you know as Rogaine, is a solution for treating it. It's 2% solution in men and women, 5% solution is only FDA approved for men. It causes vasodilation, increasing cutaneous blood flow. The increased blood flow tends to stimulate the hair follicle growth. When the drug is discontinued, however, the hair loss recurs within 3 to 4 months, which stinks. Finasteride is an oral drug used for male baldness. Finasteride is one we talked about for BPH in previous chapters, but for the low dose treating alopecia or hair loss in men only. Your text has a little section on sunscreens. I'm just going to go past that. Burn preparations. It has a little chart where it discusses the different degree of burns. I'm not expecting you to know the degree of burns. That's covered in other classes. Mafimide is a sulfa drug, leaves a burning sensation. Sulfadiazine or Silvadine is the one you'll see the most, but it can leave a skin discoloration. And it's put on. It has a sulfa drug in it. It's cooling and it helps prevent infection in that wound while it helps to treat it. It's used for 2nd and 3rd degree burns. Make sure you look over some of these charts in your text and your prototypes and your nursing process sections. And actually, that is it. Don't stop now. We're almost there. 2 more chapters for this unit, 2 more chapters for this semester. So keep going. You're almost done.